I think we're going to go ahead and get started. So my name is Vanessa Lynch. I am a Pennsylvania campaign coordinator with Moms Clean Airport. Welcome again to our Health First webinar, Polluting Our Future, How Living Your Oil and Gas Risks Health for Developing Babies. Moms Clean Airport is an organization of moms and dads united against air pollution to protect our children's health. I want to thank all of our Health First partners today for their support, including our hosts, the Evangelical Environmental Network, Earthworks, the Center for Goldfield Justice, Environmental Health Project, and Clean Air Council. Health First is a coalition of healthcare professionals, public health advocates, parents, and faith leaders working to raise awareness of the health impacts of air and water pollution, as well as climate change threats. Support frontline communities whose health is directly impacted by environmental pollutants, and advocate for policies that prioritize public health for Pennsylvania families, especially communities of color and low-income communities who are disproportionately impacted by pollution. We envision a world where all Pennsylvanians have equitable access to clean air, pristine water, and a stable climate in order to safeguard public health. Our first speaker today is Dr. Nicole Deziel. Dr. Deziel obtained a Master's of Industrial Hygiene and Doctorate in Environmental Health from the Johns Hopkins Bloomberg School of Public Health. Her research is focused on assessing the impacts of exposure to traditional and emerging environmental contaminants in pollution-based studies. Her research uses a combination of large administrative data sets and detailed community-focused studies to advance understanding of environmental exposures to chemicals, particularly carcinogens and endocrine disruptors. This research illuminates exposure mechanisms, underlying associations between environmental chemicals and disease, thereby informing more effective policies to reduce exposures and protect public health. Thank you so much for joining us today, Dr. Deziel.
Great. Thank you so much for the invitation. I'm very pleased to be here to talk about unconventional oil and gas and impacts to children's health. Just going to share my screen and get started with the presentation. So I'll be talking about unconventional oil and gas development and impacts to children. I'll refer to unconventional oil and gas development as UOGD or fracking. So for this presentation, I'd like to first give an overview of the overall literature, and then I thought it would maybe helpful to describe two studies from my own research group and walk through those. And one of those is related to birth defects, and the other one is related to childhood cancers with a focus on exposures during the perinatal period. Before I get started, I just wanted to set the stage a little bit to acknowledge I've been working in this space for approximately 10 years. And 10 years ago, we really knew very little about this technology of unconventional oil and gas development because this technique of horizontal drilling and high volume hydraulic fracturing was very new. But a lot of researchers raised questions and concerns about potential exposures and hazards, like in this paper from a group in Colorado in 2014. Fast forward now, 10 years later, we have seen this rapid expansion in unconventional oil and gas development, with this graph showing production from shale gas or UOGD in different formations around the country. And this rapid expansion in this new technology has led to about 160,000 active fracking wells throughout the US, about 4 million people having their home within a mile of a fracked well, and about 9 million people having their drinking water source within 1 mile of a fracking well. And we now have evidence for many of those potential hazards. So we do know that these industrial sites can release air pollutants like volatile organic compounds, particulate matter. There's increased truck traffic, emissions of greenhouse gases like methane. There can be spills of wastewater, noise, odors, light at night, seismic activity. So we now have much more evidence about these specific hazards. We also have many health studies. This slide actually needs to be updated. It's hard to keep pace with all the research that's being done, but there have been over 60 health-specific or epidemiologic studies of communities and populations living near unconventional oil and gas and various health outcomes, with the majority of studies being related to perinatal outcomes, things like low birth weight, preterm birth, and birth defects. And I'm an exposure scientist, so I spend a lot of my time thinking about how and who people are coming into contact with different emerging exposures. So I just wanted to emphasize this one aspect of some of the research. Most of the studies that have been conducted use some sort of proximity-based metric to capture exposure. So we look at where people live and estimate things like how close is the nearest oil and gas well, or we may draw a buffer, like a radius around a home, and count up the number of wells within a certain distance of homes. We can create metrics where we give more weight to wells that are closer to homes. So these are some of the common features of many of the studies and how they estimate exposure. So these can be very useful metrics because we still don't really understand which of all those stressors might be driving some health associations. So by looking at proximity to the operations, that kind of serves as this aggregate metric when it's this complex industry with many possible hazards. It's also very interpretable and relevant for policymakers and residents, because makers want to know, well, how close is too close? You know, residents want to know how close is safe or how far is safe. So having these types of proximity-based metrics are also very practical and useful for policy. But some of the drawbacks are that when we see associations between residential proximity to oil and gas and health outcomes, we don't really know which hazard or feature could be responsible for those associations, you know, which could inform interventions or mitigation strategies. And also this kind of assumes that, you know, all these wells within this buffer contribute to the exposure, and that being closer is you know, is associated with a higher likelihood or intensity of exposure. And you could think about, you know, if the predominant wind direction was going this way, you know, these wells, even though they're within the buffer, may contribute less to this home's exposures. And I just want to point out, in some of our work, we are working with hydrogeologists to get a more accurate or specific picture of these proximity metrics. So in my group, my hydrogeologist collaborators have developed these more water-specific metrics that take into account topography and water flow to show these are really the buffers that would be important for estimating the likelihood of contamination of someone's drinking water source. So you can see it's more of this surfboard shape rather than the circular buffer. So I'd like to talk a little bit about two of these studies from my group. One is related to unconventional oil and gas development and birth defects in Ohio. Birth defects are affect 1 in 33 babies. These can have very severe outcomes, including infant mortality, disability, specialized needs throughout the lifetime of the child. And in Ohio, we selected Ohio. There's been a lot of work done in Pennsylvania, and certainly this work would be relevant for Pennsylvania. But Ohio also seen a very large increase in natural gas production. And in terms of those, how close is too close, they're kind of set back. The allowable distance between drilling and homes is pretty lenient compared to other states. And there hasn't been as much research done in Ohio. And this was led by a Yale student, Casey Gaughan, who's now in medical school. And here's just a map showing the shale reservoirs and all the incredible density of fracking wells on the eastern part of the state. We focused on structural birth defects because they are it's more plausible they would have environmental risk factors. And we obtained birth certificates as well as surveillance data from the entire state. So birth certificates would capture more severe birth defects, and then the surveillance system captures children who are up to 5 years of age, because some birth defects may not manifest themselves right away. And we used 3 different exposure metrics. We looked at whether or not you had a well within 10 kilometers of the home. We also did a density type metric where we counted up the wells and weighted them by distance. And we also used that water specific metric. And this table shows the results of our study, where we saw statistically significant associations with living near unconventional oil and gas wells and neural tube defects, and particularly spina bifida, as well as limb reduction defects. And even though this isn't statistically significant, which is something, we talk about in epidemiology, you do see that these, if there was no association, the odds ratio would be 1, and these are all elevated. But it is challenging because birth defects, fortunately, are still quite rare, and that can make it very challenging to study, just because you don't have as much statistical power to capture these. But the trend is certainly showing elevated risks, with a few of these birth defects reaching statistical significance. So we did see some positive associations between living near unconventional oil and gas development and neural tube defects, limb reduction defects, and spina bifida. There was this one inverse association for hypospadias, one particular birth defect. But because these are rare, and actually not that many babies had wells within 10 kilometers, if you're looking at the whole state, that sort of limited, it made it challenging to do this type of research. It's challenging to study rare diseases. And then I'll just briefly go through my second study, which is on childhood leukemia, which is the most common cancer among children. And it's thought to be multifactorial, likely a combination of genetic and environmental factors. And there have been a few environmental pollutants that have been linked to increased risk of childhood leukemia, including radon and benzene, as well as pesticides and smoking. And unconventional oil and gas development has releases or emits several known carcinogens, including 17 leukeminogens have been identified as being emitted either into the air or potentially released into wastewater, including benzene. So in this study, which was led by Cassandra Clark, who was a doctoral student at Yale, she's now at the University of Minnesota, we obtained all the birth and cancer records for the state of Pennsylvania. I won't go through all the details, but we matched the cancer records with birth records and had 405 cases of leukemia and 2,000 children without cancer that we included in this study. And again, we took great care with our exposure assessment, where we use this we applied this more a density-based metric and this water-specific metric, and we considered different windows of exposure. We looked at preconception to a year before diagnosis, and then we also just honed in on in utero exposures, the perinatal window, because that's thought to be important for this particular cancer. Similarly, childhood leukemia is quite rare, and in this table, I'm just showing the number of cases and controls that had an oil and gas well within 2 kilometers. And you can see the numbers are a little small, 14 cases, 37 controls. And as we increased our buffer size to 10 kilometers, then we have some more cases. Again, this just poses a challenge in terms of the statistics. However, despite that, we did see a statistically significant association between living children who were born within 2 kilometers of an unconventional oil and gas well had 2 times the odds of developing leukemia compared to children who lived further away. And after we, we adjusted for other factors, we still saw an elevated risk. Also, importantly, when we focused just on the in utero period, we saw 2.8 times greater odds of developing leukemia, although we have kind of a little less precision in these estimates. And also you can see as we take a larger and larger distance, the relationship kind of decreases, suggesting that, living closer has the highest estimated odds of developing childhood leukemia. And we saw similar results when we used that water-specific metric. So just to summarize this study, we found that living near unconventional oil and gas development was associated with 2 to 3 times greater odds of developing childhood leukemia. We tried to focus in on the water contamination as a potential route of exposure. Those yielded similar associations. Again, kind of the rarity of the disease and the low prevalence of exposure prevented more complex analyses. So to conclude this presentation, I would like to give some takeaways from the entire body of literature. Most of those more than 60 studies that have been published have documented that people who live near unconventional oil and gas development have greater risks than people that live farther away. And the strongest evidence is for perinatal outcomes and impacts to children. And these studies have been done in multiple years, in multiple populations, in multiple states, and they're all kind of pointing to this rather consistent associations. There's some variation here and there, but overall, living closer is associated with a variety of children's health outcomes. And I want to share this excerpt from this recent report that I participated in this panel advising the state of California on their oil and gas policies. And as a group, we concluded that the totality of epidemiologic evidence provides a high level of certainty for a causal relationship between residential exposure to oil and gas development and poor perinatal outcomes. So although several health outcomes, particularly those in adults, are somewhat understudied, the body of evidence does suggest that living closer to unconventional oil and gas development has greater impacts, especially to children. And there are these improvements in the exposure assessments that could help sort of identify the underlying etiological factors and improve the statistics. But certainly, even though there's still some questions and more work to do, there's still sufficient evidence to take some regulatory action to protect public health. And with that, I would like to acknowledge all my co-authors, and I'm happy to also share a list of relevant publications. Thank you.
Thanks so much, Dr. Deziel. It was a really informative presentation. I'm sure we will have good questions for you at the end of everybody else's presentations as well. Up next, we have Kim Anderson. Kim serves as Evangelical Environmental Network's Director of Member Mobilization. EEN inspires, equips, educates, and mobilizes evangelical Christians to love God and others by rediscovering and reclaiming the biblical mandate to care for creation and working toward a stable climate and a healthy, pollution-free world. Kim holds an undergraduate degree in psychology from Marietta College and a master's in business administration from the University of Akron. Kim spent nearly 20 years in banking, including working in human resources for one of the nation's largest banks. Kim's had a passion for educating people about the impact pollution has on people's health, and her faith has only strengthened her conviction in creation care. She's loved that she gets to live out this calling with him for the last several years. A northeastern Ohio native, Kim now lives in the mountains of western Pennsylvania with her husband and two busy and creative children.
Great. Thank you, Vanessa. As Vanessa said, my name is Kim Anderson, and I'll be talking about fracking and birth outcomes and doing a summary of what some of the other research says. We heard about some great research and just wanted to share a little bit more. So first of all, just in case you're not that familiar with fracking, it's a part of the shale gas development process that involves high pressure injection of water, sand, and chemicals into deep rock formations. It's known to release air pollutants like PM 2.5 or soot, volatile organic compounds, and hazardous air pollutants and water contaminants. And it often occurs close to where people live, work, recreate, and go to school. There are key birth outcomes that have been studied. These are some of the most common ones. You have preterm birth, low birth weight, and small for gestational age, and birth defects. And as Dr. Deziel mentioned, these outcomes can be linked with lifelong health, cognitive, and developmental impacts. And then you also have stillbirths and miscarriage that can happen as well. There's a widely confirmed body of research, as we've learned. Here are some of the main sources from which health outcomes related to shale gas development can come. This is not an exhaustive list, but this is some of the more well-studied outcomes. Things like air pollution, benzene, and ozone can be linked with inflammation and placental disruption. Water contamination can be linked with endocrine disrupting chemicals, which we'll talk about in more detail in a minute. Noise, stress, and light pollution can contribute to maternal stress responses. And then also social determinants can be important, noting that low-income communities often live closer to fracking sites as well as to all forms of pollution. Just for this webinar was a recent study that came out from St. Vincent College right here in Pennsylvania with Doctors Poole and Boland. And this study was different than the others in that it was national. Many of the other studies were either county specific or specific to a region in a state or a whole state. But this one looked at national data using county level data on a national scale. And it confirmed some of the individual state level impacts that we've seen on a state level, but on a national scale. In this paper, researchers wanted to find out how the chemicals used in hydraulic fracturing linked two specific birth outcomes, preterm birth and low birth weight, focusing on data from 2015 to 2018. So a little bit more on the endocrine system. It's a network of glands that produce hormones, and hormones act like messengers, a messenger system in the body, telling certain organs to work faster or slower, to produce more or less of what they produce. And they're a key component of development and growth at younger ages. They can impact growth and development, metabolism, reproduction, mood, and emotions. They can also increase the risk of cancer development depending on if too much or too little of a hormone is acting on a part of the body. The endocrine process is fine-tuned, and interruptions from the environmental influences, even in small quantities, can have an outsized effect, and even a small amount can be responsible for a lifetime of health consequences. The methods of this study were to use county level data about wells and perinatal outcome data, and it also controlled for confounding variables to ensure that there weren't other factors influencing the change in endocrine systems. Socioeconomic indicators were considered, like health insurance coverage rates, poverty levels, education attainment, population density as a proxy for rural versus urban environments, which can influence both exposure to fracking and access to care. Drug-related death rates included as an additional social determinant that may co-vary with both maternal health and stress-related outcomes like preterm birth. And then also took into consideration agricultural chemicals that may influence birth outcomes, especially in rural areas. Researchers added relative levels of fertilizer, insecticide, and herbicide use by county using available agricultural data, just to ensure that the data that you were contributing, controlling for confounding variables. The study looked at a very large list of hormone targeting chemicals used in fracking. In other words, chemicals that target or impact either estrogen or hormone or testosterone hormones. One result that stemmed from this study was a very large list of hormone targeting chemicals. This is just a snapshot of the list. The whole list is tens of thousands of entries long, and it could be a useful resource for further research. The results of the study is that compared to counties that had no wells, every unit increase or for every well that was added in density of wells, there were changes in estrogen, or there were changes in preterm birth rate and low birth weight rates, excuse me. So you can see some of the impact and the changes there. For example, Washington County in Pennsylvania has a lot of wells, and they would have a higher rate of outcomes based on this data. So that some discussion about this study, it reinforces previous regional studies that fracking exposure linked to adverse birth outcomes, and it confirmed that on a national scale. It emphasizes the importance of understanding the specific ingredients in fracking and their differential effects on hormonal pathways and birth outcomes. And it suggests further exploration is needed to understand the mechanisms behind these associations. These are some of I mentioned there's a body of work that is available out there, and these are some of the previous studies that have been done, and we will share this with you after the fact in our slides. And if you have any questions about this study beyond the Q&A time today, or if you want to get in contact with Ian, I've listed my contact information there, and we will also be sharing some action alerts if you wanted to take action today. Thank you.
Thank you, Kim, for that great presentation. Up next, we have Melissa Ostroff. Melissa is the Pennsylvania policy and field advocate at Earthworks, where she leverages optical gas imaging technology to respond to community concerns, inform policy, and ensure public health and environmental protection are prioritized across the state. Melissa began her career assisting low-income Philadelphians seeking affordable legal aid. Later, serving in communications roles with the Pennsylvania State Senate and the University of Pennsylvania. While working at the university, Melissa completed her Master's of Public Health degree, conducting fieldwork in Philadelphia with the Community Engagement Core of the Center of Excellence in Environmental Toxicology. A Fulbright Scholar, Melissa holds a Master's of Public Health from the University of Pennsylvania and a BA in Government from Franklin and Marshall College.
Thanks, Vanessa. I'm just going to go ahead and share my screen here. Okay. Great. Yeah. So I'm Melissa Ostroff. I'm our Pennsylvania policy and field advocate at Earthworks. I'm based in Philadelphia, but work across the state focused on oil and gas policy issues and doing some field work that I'll talk about in a bit here. And Earthworks is a national organization that's focused on working with communities to protect folks living on the front lines from the harms of extractive industries, including oil and gas. But I'll be speaking specifically to how a strong state methane plan in Pennsylvania can protect Pennsylvania families from some of the health impacts that were discussed earlier in the webinar today. So first, just to kind of provide an overview, what is in oil and gas air pollution? So I'll be speaking specifically to air pollution here, and typically it contains a combination of health hazardous pollutants, including benzene, ethylbenzene, formaldehyde, and hydrogen sulfide. And so a number of different volatile organic compounds are part of the mix, as well as methane, which is 86 times worse for the climate than carbon dioxide over the short run. So the pollution that comes from the oil and gas industry has both an impact on health and on climate. And some of those documented health impacts, of course, include poor birth outcomes that are the subject of this webinar, but there are also studies that have found a correlation between living close to oil and gas facilities and experiencing a lower life expectancy, higher incidences of certain cancers, asthma exacerbation, and other respiratory illnesses that would be increased. But the challenge with oil and gas pollution is that most of it is invisible. And a really incredible technology that we have at Earthworks is an optical gas imaging camera. So that's pictured here. It looks like a 1990s camcorder, but it's actually a truly incredible tool to help us make the invisible visible when it comes to oil and gas pollution. We're not able to quantify the amount of pollution using this camera, but it does allow us to clearly see volatile organic compounds like benzene, as well as methane that are being emitted from well pads. So here we have a well site that's located in Boyce Park in Allegheny County, and using the optical gas imaging camera, we were able to see really terrible emissions coming from this small well site that, we could smell something was off in the park area, but we don't know how long this was going on for. And unfortunately, these types of sites often don't receive frequent inspections. And so a really terrible leak like this, where there's truly like a piece of equipment that's missing, can go on for a very long time if, frequent inspections and repairs are not required. But we do have some new federal requirements to cut pollution from oil and gas facilities like this one. About a year ago, a little over a year ago, in March 2024, the EPA under the Biden administration finalized a rule to reduce methane emissions from the oil and gas industry. And this new rule requires monitoring for leaks from wells regardless of size, so even small wells like the one we just saw, using zero emission process controller devices. So this is just a technical description of a piece of equipment on a well pad that normally would intermittently vent out pollution, but there's new technology that would allow it to just completely stop venting pollution. So this would require that zero emission technology, eliminating routine flaring at large wells. So this would be the burning off of gas at certain well sites, and then creating a super emitter program, which would allow third-party organizations, including potentially some environmental organizations, to track some of the worst pollution events and ensure some more accountability for cleanup of major pollution events. And states have until March 9th of 2026 to submit their plan for how they're going to uphold these standards and implement them. So that's a little bit less than a year from now. So what can Pennsylvania do about the EPA methane rule? So, obviously we're under a different administration now than when the EPA rule on methane was finalized. And so there is a lot of opportunity for states to really take charge here and ensure that those protections that are part of the EPA rule are incorporated into state policy. So, like many other environmental policies that started under the Biden administration, the EPA methane rule's future is somewhat uncertain. So in Pennsylvania, a state rulemaking can really protect Pennsylvania families from this pollution and ensure that those protections that were part of the EPA methane rule are actually implemented here in Pennsylvania. And as part of a state rulemaking, Pennsylvania's Department of Environmental Protection can actually build on the original EPA rule and make it even stronger by including additional types of equipment that are prone to leaking. You can see on the right-hand side, just a fitting on a pipe can be very prone to leaking. So there's all different kind of areas where methane leaks commonly happen. So including more of those, adding stricter standards for inspections, requiring faster equipment repairs so that the leaks aren't going on for a really long time, and connecting impacted residents with methane monitoring and health resources. So we really feel that Pennsylvania has an opportunity here to build on the EPA methane rule, make it stronger, and ensure that any potential rollbacks under the Trump administration don't have the effect of actually leaving Pennsylvania residents more vulnerable to oil and gas pollution. So what can you do? So there are a couple of different opportunities to provide your feedback to Pennsylvania's Department of Environmental Protection about a methane state plan. I think the most important thing to share at this point is that we need a state rulemaking to protect Pennsylvania families from methane pollution and from Trump's EPA rollback. So making that really clear in your feedback that you want protections that allow for Pennsylvania residents to be protected through Pennsylvania's state authority rather than relying on the EPA rule, and doing that through a state rulemaking. And you can share your thoughts with DEP right now. They actually have a webpage to provide feedback on the methane state plan. I created a little bit.ly link for that, bit.ly/methane pollution. However, I will note that the official public comment period is opening up soon. We don't have a date for that yet, but we're expecting that to open up in the next few weeks. And that is really the most important opportunity to provide your feedback, because that feedback will be officially on the public record. So we want to make sure that people are aware of that and stay in the loop. And so you can sign up for emails if you're not already on Earthworks email list or on an email list for one of the other organizations hosting this webinar. You can sign up at bit.ly/Earthworks updates, and we will share with you when the public comment period opens up for the methane state plan in Pennsylvania. If there's any other questions, you can feel free to reach out to me at my email address or phone number listed here. Thank you so much.
Thank you so much, Melissa, for that presentation. And hi, everyone. My name is Nina, and I am a community advocate with the Center for Coalfield Justice. I am going to stay off camera so that our presenters can be highlighted while they're answering their questions, but we do have a few. And if you have any further questions, please use the Q&A feature at the bottom of our screen. Quickly, just a little bit about the Center for Coalfield Justice. We are a frontline organization that works in Washington and Greene counties in Pennsylvania with families that live near oil and gas operations in those two counties, among other things. So let's go ahead and get into our first question, which is for you, Dr. Deziel. And the question is, what top points should regular people take away from your research?
Yeah, so I think others also summarize the research quite well. I would say that of the more than 60 studies that have been, health studies that have been done in populations living near oil and gas wells, the majority of studies provide evidence of links to between residential proximity and a variety of adverse health outcomes. The body of evidence is strongest for effects to children, like perinatal outcomes, like low birth weight, preterm birth, and birth defects. And that a recent public health panel felt that this body of evidence was sufficient to establish a causal link. So I think while there's still some questions about which pollutants may be driving these associations, there is a strong body of evidence, and that the current allowable distances between homes and oil and gas wells are likely not sufficiently public health protective.
Great, thank you for that answer. Next, someone would like to know, what are the policy-related implications of this research?
I can speak to that. Just reiterating that the methane state plan is a really key component of protecting people who live close to oil and gas where it's currently sited, by reducing the air pollution that comes from these facilities and increasing requirements for inspections and quicker repairs. So we're really paying attention to what Pennsylvania is planning to do in terms of the EPA methane state plan, and making sure that that state plan is grounded in state authority that can really protect Pennsylvanians. But additionally, as was mentioned earlier, having the current distances between well sites and where people live, where kids go to school, is certainly not health protective, according to multiple studies that have shown health impacts living in close proximity to oil and gas. And there are policy opportunities around increasing what are called setback distances between where oil and gas well pads are allowed to be sited and where people live, work, and play. And so there's currently a petition in Pennsylvania's DEP that seeks to increase that distance so that well pads are not allowed to be built so close to homes and schools and other vulnerable locations. So I think those are the two main ones, but there's certainly others folks want to jump in.
Yeah, well, I would underscore what Melissa described, that these setbacks, while certainly important, do not actually control the pollution. So particularly things that are of regional concern, like methane and other greenhouse gases that contribute to climate change. So just moving, the wells farther from homes doesn't do anything to mitigate those other hazards. And I would also offer this perspective that if we move the wells farther from people, then we're starting to encroach on our wildlands, and that can have ecological consequences as well. So I think, some of these other solutions like engineering controls, present other opportunities, as well as transitioning away from fossil fuels altogether to more renewable energy sources.
Thank you both so much for your answers. Melissa, this question is for you. Brenda would like to know if you do work with EPA with methane gases in the Eastwick community in Pennsylvania, and they're dealing with the Clearview landfill there.
So Earthworks has not been involved in looking at methane pollution from landfills, but I believe there are other organizations, maybe Physicians for Social Responsibility, PA, who have used the same optical gas imaging camera that can observe methane emissions and use that to actually look at landfill methane. So I think there's an opportunity there. And if the person with that question wants to reach out to me, I can put my email in the chat, and I'm happy to try to dig into options there. When I did my field work as part of my Master of Public Health program, I was involved in Eastwick a bit on some other issues. So definitely interested in connecting and seeing what's possible.
Thanks, Melissa. Joyce is asking if we have heard about the desire for LNG or liquid natural gas production in the state of Pennsylvania. And since the gas is extracted through fracking, how will that affect work in these counties? She says that we are advocating against LNG production at the endpoint of production in Chester, but what can you do on your end? I'll say quickly, in Washington, in Greene counties, we are advocating against the LNG production because of the increase in fracking that will happen in our communities and how that will add more wells. But I will also pass this along to our panelists if they have anything else to add.
I can weigh in from a research perspective. I think this raises an important point that most of the research has been done around active unconventional oil and gas wells, and there is an entire infrastructure associated with oil and gas. For example, I know when I was out doing water sampling in parts of Pennsylvania and Ohio, there were a lot of concerns about ethane cracker plants and compressor stations. And again, these are not as commonly included in sort of these proximity studies. But we do know that, for example, I did one study on ethane cracker plants, and they also emit many toxic chemicals and carcinogens. And these are, downstream converting the petroleum products into plastics. So yeah, I think this is a good point that it's important to think of the whole life cycle of the petroleum industry, in addition to kind of the active oil and gas wells.
Yeah, there are lots of things that the industry is doing to try to make oil and gas last longer. Our next question, I think this is also for you, Melissa, but with uncertainty at the federal level on methane safeguards at the EPA, what should states be doing with their methane protections?
Yeah, that's a great question. I would just reiterate that we really need a state rulemaking that grounds Pennsylvania's state methane plan in Pennsylvania's own state authority rather than only grounding our methane plan in the EPA rule itself. Just because we do expect, unfortunately, that EPA methane rule, it very likely will change and be weakened, potentially could be removed altogether. And as a result, the most important thing that states like Pennsylvania can do is ensure that their methane state plan is grounded in the state's own authority. And doing so by rulemaking is one of the best options, one of the best approaches there.
Great. And then we only have one more question unless anybody else wants to put something into the Q&A at the bottom. But this is open to anybody, and that is, what can groups or individuals do to take immediate action to influence related policy?
I think participating in the public comment period coming up is the best opportunity. And again, we will share out the link to be able to submit a public comment as soon as that opens up. We're expecting that window to open up hopefully sometime over the next month. In the meantime, there is that DEP website that does allow for immediate feedback on the methane state plan. And we created that bit.ly link on methane pollution. If you want to submit your feedback now, it certainly doesn't hurt to do so. But the most important opportunity will be that official public comment period coming up.
We do have one more question in the chat for Kim, if that's okay. So it came in a little late, and our asker wants to know, how effective has outreach to church leaders been on this topic to date?
Pretty effective. EEN has done a lot of outreach in the state of Pennsylvania and across the country. And, oftentimes we start with our shared values with the faith leader that we're talking to, and then, continue to educate them and bring it towards methane or other issues that are impacting the state. And so we have a number of people that have taken action and have had a lot of people sign action alerts and petitions and things like that over time. We do get some pushback, but we really start with our values and rooted in the Bible, and try to get people to understand why we care about this, and we talk a lot about children's health. Our mantra is creation care is a matter of life. And so we help people understand the impact for starting in the womb, as we've learned today, through the end of life, that there are lots of environmental impacts on people's health. And so we focus on that as a shared value and start there.
Thanks everybody for attending our webinar today. We enjoyed having you all, and despite a number of technological issues, I am happy to say that I think it went very well. I hope you'll have a wonderful weekend of celebration, whether it be spring or Easter or whatever you happen to celebrate. And we hope to see you the next time we have a webinar.